The movement believes that its actions are justified, including the controversial campaign to block foreign nationals from accessing public health care and education in South Africa. Well, to offer a legal and human rights perspective on the issue, we now speak to Nomzamo Zondo, who's the Executive Director at the Socio-Economic Rights Institute of South Africa, SERI. Thank you so much indeed for joining us, and welcome to the program.
Good morning, Peter. Thank you for inviting us.
Let's start with your reaction. How concerned is SERI about reports of foreign nationals being denied access to public hospitals and schools?
It's difficult, Peter. It's difficult to imagine that anyone can think of targeting a child. And I don't think of that as a human rights lawyer. I don't think of that as the executive director of SERI. I think of that as Nomzamo Zondo, who also happens to be a mother. It's even worse to think that someone who gave birth 3 days ago, who's still feeling weak, has to advise Ndoro what the law is in this country, that healthcare to birth mothers and children up to the age of 6 is free. It's difficult. But we've been considering our position that we believe that our humanity demands that the things that we believe are necessary for us to live should be extended to everyone. And that remains SERI's position. We also, I think, not being experts in this, and we believe that our colleagues who are at organizations like Section 27, like the Treatment Action Campaign, might be better able to respond. But we also believe that it's actually a risk for South Africans to have a segment of the population untreated and unserved by the healthcare system. Because what that does is that it weakens our own protections. The reason why, for instance, we have people chasing the vaccination of children is because we know communal protection is the first line of defense. The reason we have people who track patients with tuberculosis is because we know communal protection is a line of defense for the whole community. And so when we have an organization intentionally going out to exclude a section of the population, they are opening a door that threatens all of us.
Operation Ndoro says that, look, we're not saying that they can't access health facilities, but they must pay for the service instead of getting it free.
Look, so for instance, as I've explained, there's the law about who gets free services. There's a law on who pays. In any event, in private hospitals, we know for a fact, for instance, that the former First Lady of Zimbabwe was treated at a public hospital. Those with money go to public hospitals. In South Africa, those with money go to private hospitals because that's what they can afford. The people that they are chasing away at public health care facilities are the poor, are the people who can't afford to pay. And so to give that offer of saying, if you want healthcare facilities, pay for it, is in effect to say, if you can't pay for it, sorry for you, you will not get it.
From your understanding, what has fueled the rise of groups such as Operation Ndoro? Is it unemployment, inequality, or is there something deeper, do you think?
So when I think alone at night and think deeply about why organizations like Operation Ndoro exist, as a lawyer, we sometimes think of a silver bullet, the silver bullet that's going to win you the case, a silver bullet that's going to solve your problem. And I do honestly believe that Operation Ndoro and President Ndoro believes that treating migrants this way is the silver bullet that's going to solve the deep crisis we are in. So you're right. It is the multiple challenges that we're dealing with, from poverty, from mass unemployment, to poor service delivery in different fronts that's brought us to this place. And really, that's why even when they decided to march on our office, our instinct was to receive them because we understood that the source of their grievance is genuine. the source of their grievance is shared not just by them, but the hundreds and thousands of South Africans who work with SERI and organizations that are connected to SERI. And we want to then have a conversation over the table about how do we work on these things. Is migration the silver bullet? And we can tell them categorically, migration is not the silver bullet.
Is there an argument that for sure there aren't enough resources to take care of everybody, and that in a situation like that, citizens should be treated and helped first if there is a bottleneck in terms of available resources?
So the challenge that I have, I've been litigating socio-economic rights for 12 years now, 12 years and a half. And while there can be a one line or there can be a paragraph that says the resources are not enough, when you go and dig deep, you find that the resources are there. Sometimes we know as a fact that money is sent back to Treasury. So not just a matter of that our government has the money sitting collectively somewhere, but a certain department has that money sitting in their bank account and they fail to use it to support the population. And so I struggle with that, with the argument of saying we don't have enough resources. But I do understand that what it does mean that when we, in the same way that we see how private healthcare works vis-a-vis public healthcare, is that where you have more numbers, there is more stress on the system, and there is a need for more efficiency. And if you ask me honestly today, is that efficiency prioritizing citizens against migrants? I think maybe that argument could be made. But as I explained earlier on, that's not how health works. If you decide to prioritize anyone to the exclusion of anyone, you're going to run into challenges.
Operation Dudula also says that, look, the way that foreign nationals are treated in South Africa and allowed to get away with things, this is the words that she used, South Africans would not be able to enjoy the same privileges in countries in the region. So how do we manage this supposed imbalance where in Zimbabwe it's unlikely that a South African might be able to get free medical attention there, whereas a Zimbabwean might in South Africa?
So I agree with her that might be factually accurate. I don't know because I haven't researched it. But what I can say is that we are driven by our history. We are driven by the promise that is made in our constitution. We've decided to value the humanity of everyone because we know what happens when we don't. And so even if you can say to me 100% in the SADC region, you can even say 100% in the continent. In the continent, you will not get the free healthcare services as a foreigner. I'm still going to ask you, as a South African who has lived through what you have lived through, do you want to live in such a country? Because you must understand that we have countries even where children don't get free education. We have countries where beaches are not open to everyone. Do we then say we want our beaches to be private, people must come and buy them because what everybody else is doing? We don't. We decide what are our convictions, what are our principles, and we live by those.
Nomzamo, we're going to have to leave it there. Unfortunately, we've run out of time, but thank you so much indeed for giving us a perspective on this burning issue at this time. Thanks very much indeed for joining us.
Thank you, Peter.
That was Nomzamo Zondo, who's the Executive Director